Michelle introduced me as former student of Clyde, but I think it's fair to say I am lifetime student of Clyde. Student of Clyde Hertzman School of Thought, School of Education, which was one of a kind. I want to say how honored I feel to be part of this very important day, to pay my tribute to the scholar, one-of-a-kind scholar who graced our careers and our lives with his remarkable body of knowledge he held and he generated, but also with his simple and warm friendship. Today I want to show you a glimpse of international Clyde Hertzman, in continuing what Michael has already showed, and I want to continue on that line. The project I want to talk to you about is, in a way, continuation of our WHO social work on social determinants of health. During the time that WHO commissioned Michael to set up the social determinants of health, Human Early Learning Partnership acted as the knowledge network for ECD. In this capacity, we undertook 2 years of extensive research to do global environmental scan to identify policies, programs that are working, that are benefiting or counterproductive to ECD, then compile a report and inform politicians and policymakers on how can we use ECD, this potent social determinant of health, not only enhance the state of lives of children, but also enhance the population health and make health a much more equitable commodity, to attenuate, if not eliminate, the gradient, the sharp gradient that everybody has been talking about today. We see the SES gradient that we see in distribution of health. In this capacity, we put the report together to commissioner, and then the commissioner excerpt of our report appeared in commissioner's report as Chapter 5, Equity from the Start. In this chapter, in this report, we made a number of recommendations, and some of the recommendations that are very relevant to the project that I'm going to be talking about were such as to enhance the state of ECD, ECD-related processes need to be monitored and measured against a set of internationally agreed upon standards, that building ECD promoting initiatives around the existing capacities or even obligations of the states or nations makes them more efficient and more sustainable. And as the impact of ECD goes well beyond the borders, so should be our efforts. We need to get together, pool our resources, and create global alliances to work on ECD and ECD matters. While this was happening in WHO, something else was happening in another UN agency. At the Committee on the Rights of the Child, UN Committee on the Rights of the Child, something equally significant, seemingly separate, and it took a brilliant mind like Clyde Hertzman to connect the dots. The Committee on the Rights of the Child is the monitoring body of the Convention on the Rights of the Child. The Convention on the Rights of the Child was adopted by General Assembly in 1989 in recognition of the fact that the Charter of Human Rights is not adequate to protect children. Overwhelming number of countries right away ratified the convention, by today 193, so you can see the political will behind this. And by virtue of this ratification, they have to A, review their domestic laws and framework and administrative process to make sure that nothing is counterproductive, nothing is against convention, everything is aligned with the principles of convention, and B, every 5 years to report on the state of children's rights in their states. So from 1989 to 2000, the committee had reviewed tens of reports and had seen enough and had come to an alarming observation that although Article 1 of the convention clearly defines child as any individual below the age of 18, but most of the reports coming to the committee are talking about older children, are overlooking the younger cohort, the early years. And that was unacceptable for many reasons, on top of all the fact that this was hitting the convention right at the heart of it. The principle of non-discrimination is the premise of the convention. So in 2005, the committee took a day of discussion and analyzed this issue to depth and produced a resource and guiding document called General Comment Number 7, How to Implement Convention for Young Children. In late 2005, early 2006, over a fateful dinner in New York City, Clyde sat around the table with a number of people, including a gentleman who is still our collaborator to this day, from the Committee on the Rights of the Child, and he started talking how unsatisfied committee is with this, with the way nations handle this general comment. It's not serving the way it's supposed to be. It's theoretical, etc. And there, Clyde, the light went on. He looked at it and he said, "This is our own recommendations in a nutshell. Here is ECD processes that needs to be monitored. Here is a processes that already builds upon the existing obligation of a nation, report writing obligation. And it's a process that needs global alliance, needs big developmental agencies and child rights advocates to come together and pull this." So he approached committee with representatives of UNICEF and WHO, and committee took a few months and wrote to us and invited us to ask us as in Human Early Learning Partnership to act as the secretariat of a project, put together an ad hoc group, and start working on operationalizing General Comment 7. The argument Clyde had put to committee was that this is a comprehensive, wholesome document prepared in all good intention, but remains underutilized. We just know how to do it. We have to operationalize and make it easy to use. This is the group we put together. HELP acted as the secretariat, number of UN agencies, number of international NGOs, and then by 2008, we had the draft ready and we showed to the committee. The tool we developed basically was a set of indicators, 17 set of indicators, each one designed to address one particular right relevant to childhood, from right to breastfeeding to right to play, etc. All of the indicators had the same generic structure. They all ask 3 sets of questions, structural questions. What are the policies and laws in right to support of that right? Process questions. What are the programs and initiatives to act upon the policies that are in place? And finally, outcome. What has happened to the children or the environment of that right as a result of this structure and processes in place? And this is an example of one of the indicators. Every time the answer is no, we provide suggestions, such as if there is no initiative to raise awareness against violence, parenthood, positive parenthood education, in-service education, so on. And then we provide links to these programs so the countries do not have to start from scratch. Following the completion of the indicators, we received a letter from the Committee on the Rights of the Child encouraging us to pilot these in different countries. The first country we went was Sub-Saharan Tanzania. It was quite successful, but expectedly because of being resource poor country, the outcome indicators were notoriously low. We got about 150 evidence of processes and structures in place in support of right. Then we digitized the tool, cloned it to Spanish version, and went to Chile. Chile pilot was beyond and above our expectation. It was majorly because this was a pure and equal partnership between us and UNICEF Tanzania, UNICEF Santiago, Ministry of Children, and UNICEF Santiago and Ministry of Children of the country. The pilots cumulatively showed us that after we digitized the tool, we changed the name to Indicators of Early Childhood Rights, and then we launched the tool to the public in 2012, 20th of November, in recognition of the Universal Day of Children. The 2 pilots really showed that the mere exercise of using this to write tool becomes like inventory taking. The governments understand what is in place, what is not, and how can they go on filling the gap in capacity. They use the evidence for advocacy and for their action planning. And additionally, it showed that carefully designed and piloted tools such as this can really bring the stakeholders to the table, keep them engaged, can create responsiveness in the government in a timely manner, because the timeline is every 5 years report, and the countries have to show some progress, at least in the area of the rights, within that time frame. It can create transparency because data speaks to itself, and equity and inclusiveness as they are rooted in the human rights treaties that are built upon this non-discrimination. It can create consensus-oriented decisions because everybody's involved from the beginning and they take ownership on what the data is showing, ownership in the data, and promote accountability, all of which are pillars to good governance, all of which will enable states, social institutions, governments, as the major duty bearers under the Convention on the Rights of the Child, to play their role more efficiently, to enhance the environments of children, and to help children to achieve their maximum developmental outcome, as we heard today from most of these speakers, and as most of us have heard from Clyde. The reason for that is simple. Environments speak to genes, and the genes listen to them. So we better make sure they have something good to talk about. Thank you.